Hi, I'm Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board certified patient advocate. I'm also an educator at the Leapfrog Judy Burroughs Education Institute, which is the educational arm of the Leapfrog Group. Leapfrog is an independent nonprofit organization that rates hospitals and ambulatory surgery centers on how safe they are for patients. Today, we're going to talk about finding the right doctor for you. It's one of the most important steps you can take for your health. In this video, I'll give you a clear, practical roadmap that you can use, plus real examples and some short scripts you can actually use when you're either calling or messaging a clinic or your doctor. So, what is the right doctors? What does that mean? Well, the right doctor is the one who understands your needs, listens, explains things clearly, and partners with you on your decisions. And that might mean a different doctor for all of your problems. And that's okay. The goal is to get the doctor that is best for you and your medical concerns. Now, I'm going to give you 6 steps to consider when you're choosing the right doctor. So, step one, first of all, know what you need. Be specific. Are you looking for ongoing management like a primary care, a surgeon, or a specialist for a condition like diabetes or joint pain, or a doctor with a different approach like holistic, women's health, or geriatric care? For example, if you want a doctor who helps manage menopause symptoms and bone health, your priorities are experience with menopause, sensitivity to hormone questions, and they're familiar with your HRT options. Step two, start with trusted resources. Ask people you trust, family, friends, support groups, your current clinicians, or there's resources online. Use your health plan's provider directory for inpatient options so you do not get surprise bills. Call the clinic and ask basic questions. When you call, you'll learn a lot from that first 2 to 3 minute conversation. For an example, my client asked her diabetes educator for an endocrinologist recommendation, and so got 2 names. She then checked which one took her insurance and took evening appointments. Step three, check the basics. Quick checks that matter. Are they board certified in the relevant specialty? What are their hospital affiliations? What are their years in practice? And whether the doctor has training and experience in your particular condition. Also check logistics, clinic hours, location, telehealth availability, and how urgent messages are handled. Patient reviews can help, but use that just as a data point. For example, I had a client that needed an orthopedic surgeon for a knee problem. And so she chose a surgeon who had many ACL repair cases, not just a general knee surgeon. And so it was also affiliated with a hospital near her home, which was convenience for her surgery. Step four, look for fit and communication styles. You need a doctor whose communication style matches yours. Do you want a direct, concise clinician or someone who spends time explaining your options? Call and listen. Does the staff seem helpful? Do they return your calls? Ask whether the doctor explains risk and alternatives and whether they use the teach back method, which is asking you to repeat the plan back. Here's an example script to try on a phone call. Hi, I'm looking for a doctor who explains treatments clearly and welcomes questions. Does Dr. X usually review options and let patients ask questions? Step five, use short interviews. Treat the first visit like a job interview. Bring a list of 3 top priorities to the first visit. Ask things like, what do you think might be causing my symptoms? What are the options? And what would you recommend first? How will we measure progress? And when will the follow up be? If answers are vague or you feel rushed, it's okay to seek a second opinion. And I have discussed how to get a second opinion in a previous video to help with this topic. For example, one of my clients who suffers from migraines asked, how will we know the migraine treatment is working? The neurologist gave clear milestones that the headache should be reduced within 6 weeks. So my client felt confident to try the treatment plan. And step six, practical considerations and special needs. If you need language support, accessible facilities, trauma-informed providers, or pediatric experience, ask that directly. For chronic or complex problems, find providers who participate in multidisciplinary care that have nutritionists, therapists, diabetes education. For example, I had a mom who was looking for a pediatric asthma care doctor for her child, and she chose a clinic that had in-house respiratory therapists and evening education classes. So in summary, here is the final checklist. Define your top goal. Ask a trusted referral. Confirm insurance and logistics. Do a 5-minute phone screen. Bring your top 3 priorities to the first visit. And remember, a good relationship may take a visit or 2 to form. If your gut says this is not working, you're allowed to try someone else because your health is worth it. Thank you for watching this video today. For more resources, please visit the Leapfrog Judy Burroughs Education Institute. And if you have questions for me as a patient advocate, please reach out to me via my website at hughesadvocacy.com. Thank you and have a great day.